Hello, this is Peter Sneed. I am the current president of Northern Michigan Health Network and a longtime board member of NPO. Uh, Enclosed with this video is an agreement for the NPO CIN. This is an agreement that we've spent quite a bit of time with, and we have changed the name and are operating as the NPO CIN, where in the past we've called this simply the Northern Michigan Health Network. We thought that it would be a little easier to convey to you and communicate to you that you indeed own a CIN, a clinically integrated network, and thought it would be more appropriate calling this the NPO CIN. We just think that it's a little more clean and understandable for individuals to read it that way. Importantly, we want you to know that you do own a CIN. The question is, what is a CIN? And there's a lot of terminology we use now in medicine and a lot of these numerics and letters that we don't all completely understand, but I understand and think about a CIN, a clinically integrated network, as a collection of physicians, hospitals, surgery centers, entities that all together provide health care for a population of patients, also with the ability to contract with payers and other entities to provide that health care. And currently in our NPO CIN, we have as partners 535 specialists and primary care doctors across Northern Michigan. Northern Michigan McLaren Hospital, Michigan Medicine, which is University of Michigan's medical program, as well as the Surgery Center, Cedar Run Eye Center's Surgery Center. These entities together form our NPO CIN. The nice thing is that through this clinically integrated network, we are able to contract with payers. We are able to discuss ways to improve how we practice medicine. So from a legal entity, this is really important. It allows us to do this in a way that really we're trying to achieve what's called the triple aim. The triple aim, if you remember, is really increasing the outcomes of healthcare, increasing the patient's experience when they have healthcare, and decreasing the cost of that health care. We have added a fourth thing that in our mission of NPO, we've added a fourth thing that we want to also improve and increase the joy of practicing medicines for physicians. So with this agreement that you're going to read, we've got in there, and we really feel strongly about this, that we want this to be an inclusive agreement and not an exclusive agreement. We want people to have the ability to practice medicine the way they want to practice medicine. This comes into play many times with specialists. Specialists can be involved in more than one clinically integrated network. Primary care doctors can also be involved in more than one clinically integrated network, but that becomes a little more complicated. So as we're going through these changes in healthcare, I just think it's really important that if you would get agreements or opportunities to be involved in other clinically integrated networks, especially as a primary care doctor, just pay close attention to what those agreements are really saying. And remember that you own a clinically integrated network. In this time of alternative payment models where we're moving away from fee-for-service models and more fee-for-value models, this triple aim really comes into play very importantly. And as physicians, we are very impactful in how things are achieved in these agreements. So when we look at contracts, whether it's bundled contracting or our alternative payment models, we can be really actively involved in what the metrics are, what are we measuring, what determines what quality is, where do the shared savings go. right now, as a clinically integrated network, we've been involved in Medicare's shared savings programs that you know as both Trillium ACO and Northern Michigan Health Network ACO. Part of the reason for this new agreement is it really gives us opportunity to continue to grow and have contracting discussions with other payers and with other entities as these alternative payment models continue to evolve. So we really are excited about the changes and the opportunities in healthcare. We're excited that in Northern Michigan we practice high quality and low cost health care and give our patients a great experience. NPO is here to continue to support you and to serve you, and should you have questions about this or other questions about the clinically integrated network or just questions in general about your practice and the Northern Physicians Organization, please feel free to reach out to me. Feel free to reach out to Nathan March, primary care doctor who's very gifted and very knowledgeable in this whole area, or any of the staff at the Northern Physicians Organization, and we're more than happy to help you. Thank you for your time, and we look forward to chasing health with you.